Dr. K, very excited to sit down and talk with you this evening. You are someone who has been on my radar for a while, and really interestingly and fascinatingly blending two of my interests, which is very low carbohydrate and carnivore dieting, and fertility and reproductive health. So let's launch straight in. Can you tell us a bit about yourself and how you got to where you are?
I'm a fertility physician that's been practicing for over 30 years. I own and run CNY fertility centers. I went into medicine to help people. I initially did internal medicine for a year, and then OBGYN, and then reproductive endocrinology and infertility. Standard practice of medicine for years. And probably around 20 plus years ago, I kind of tripped over Atkins and then paleo. And I shared that with my clients to help them reduce inflammation and heal. At the same time, I was integrating a lot of Eastern medicine, massage, acupuncture, prayer, meditation, things like that. And about 12 to 15 years ago, keto and then carnivore came into my radar. And I was like, okay, this is amazing because I personally suffered arthritis, psoriasis, bowel bleeding, migraines, kidney stones, and they went away after about a month on carnivore. And that got me to digging deep and trying to understand the cause of disease. And maybe we've got nutrition completely incorrect. And I did it personally, and I write books on it. I blog about it, and I talk about it because it's the most amazing thing I've ever seen is how carnivore and fasting reduces inflammation and helps people heal almost every disease. And the foundation of life is reproduction. And I've seen such benefits to keto, but carnivore mostly.
Yeah, and it's fascinating how for people who feel great when they cut out the commodity foods, the processed foods, they're feeling fantastic. Maybe they're doing a paleo or a low carb. Yet it seems like there's another gear above that can be achieved when the plant foods and what seems to be a pretty clean diet is gone even further to a carnivore type diet. Is that was your experience personally? What do you think about that?
Well, right. Many people do well on paleo and keto, which are essentially high fat diets, but those are labeled diets. Human beings have sort of invented those terms, paleo and keto. But ultimately, we evolved out of a carnivore diet, which is meat animal based consumption, very little to no plants in our nutrition. And understand the science, there's no plant product that's essential to the human diet, none. Yet, fat from animals and amino acids or proteins for animals are pretty much essential. And we've been convincing humanity to not eat animals or meat, and the diseases are on the rise, and so is reproductive dysfunction. And so basically, plants, I call them the predators and we're the prey. And plants contain all sugars, which are glycating and toxic to our body. They contain chemicals and antigens and fiber that ferment, and all of that damages our gut. And so, if you really just get down to the nitty gritty, the simplicity of it all, it's quite amazing. An ultimate elimination diet is going to be animal based. Lion's diet, the lion's way, which is meat, salt, and water, which eliminates the number one toxins, which all come from plants.
Yeah. And I mean, it's been my experience that using carnivore dieting as a tool, a therapeutic tool with my patients for weight loss is incredibly powerful. But what you're doing for your patients, your fertility patients, I'm presuming is you're putting them on a carnivore diet. And what are you seeing in terms of their fertility when you exclude these plant foods?
Well, I believe that obesity is not the cause of any medical condition. It's a side effect of a high sugar plant-based diet and low animal fat diet. But I offer keto and carnivore. Keto is again high fat, low carbs, uh, and focuses. Some people can eat. They eat some plants, and because it's the easiest for people to sort of get wrap their head around. Well, how can I not eat any plants? But I talk about keto, but I really get right down to carnivore, a 1-to-1 fat to protein, which is critical. And I've books written on it, keto books, carnivore books, which I share with people because, again, I ask people their history, their ages, how long they've been trying to get pregnant, any medical problems, and I ask them about their weight and size, height and weight, just to kind of get a sense, because the heavier you are, the more likely you are to be really in the plant-based world and a lot of inflammation and damage to the gut. The leaner you are, it's a little sneaky. Size doesn't matter. But and then I ask people, what do you eat? Because you want to ask them what they eat. And usually it's healthy, organic, or I eat only junk food. But I want to know exactly what you eat and when do you eat it. And that gives me clues to the cause of all their disease. And so I've seen inflammation, weight drop. So many people are just interested in how they look, but it's not how you look. It ultimately turns out to be how you feel and the function of the Ferrari, right? So if you look and feel healthy, yet you're not reproducing, you're not healthy. And there's some inflammation. And so, the more we tell the story to bring us to a point where it makes sense, but the propaganda has said you got to eat fruits and vegetables. And that's the word label healthy is put in front of every phrase, healthy this, healthy that, which is ultimately propaganda. It's not even true. But I've seen weight loss, I've seen PCOS, metabolic syndrome, endometriosis go away, and I've seen male sperm improve, female eggs improve, embryos and pregnancy happen even naturally on this lifestyle.
Mm. And it reminds me of the thought of an objective marker of health, like and the subjective feeling, the objective feeling. And for fertility, nothing, I guess, is as powerful in my mind as having a regular, painless period in terms of an indicator that things are working well. What do you think about that?
Well, there are so many young women who are entering their menstrual cycles. That's called menarche, when they began having menstrual cycles. But even before that, when they begin to develop breast development and hair development, and their shapes change, which is the sign of coming reproduction. It's happening earlier due to what I believe are the plant phytoestrogens. There's a lot more androgenization, testosterone, even in the plants, which are causing women to even delay their reproduction or get more male side effects. But and then when they get their periods, there's already a lot of inflammation that's damaged the uterus, that's caused adenomyosis, endometriosis, and polycystic ovarian syndrome, where they don't ovulate regularly. They have very painful periods. And I believe it's all secondary to that plant based diet and lean meat diet. We got to remember that it's fatty meat that is really carnivore, not lean meat. So you want to add more fat to the Ferrari in order to reduce inflammation and heal properly in all of this. But yeah, it's happening to younger and younger women and girls, where they're getting, again, their earlier menstrual cycles. They're more painful, irregular, heavy bleeding, along with depression, anxiety, mental difficulties in life, ADHD, OCD, depression, which are all related to the same cause, which is a plant-based low animal fat diet.
Yeah, and it's so sad because this has become normalized. I mean, people are used to, and young girls are used to having to take non-steroidal anti-inflammatories around that menstrual cycle. They're used to going in and asking for the contraceptive pill or some kind of contraception, and it seems like the medical paradigm or the medical establishment is all too happy to provide a hormonal off button to that body alarm rather than treat the underlying cause.
Well, and that's because we're not taught the cause. We're taught the differential diagnosis of disease, and then the planned treatment, which usually incorporates drugs. And then it always goes to a healthy diet, which is lots of fruit, fiber, vegetables, seeds, nuts, lean meat, little to no red meat. So in actuality, the diet recommendations that we're giving are actually the cause of the disease. And so our community, our children, our family members are basically being driven down the wrong direction. So no matter what they do, they're going to get worse. They're going to become suicidal, depressed, ADHD. They're going to have many surgical procedures to try to fix the problem when in fact we're causing it. And you're right. The birth control pill, the abortion pill, antidepressants, Adderall for ADHD. We're a drug-driven diatribe of the wrong direction. Essentially, again, I'm not blaming doctors. Really, it's the global message that a plant-based diet is good for you that is driving all of us. And doctors are caught in the same problem. But my job as a doctor is to educate other doctors on these ideas that maybe we've got the wrong diet. And we call most diseases are idiopathic, unknown cause. And yet what I found is actually that's not true. It's simply caused by the wrong diet for a human being, which is more like a lion than it is like a pig, cow, and a sheep.
Yeah. And for the listeners, I think maybe the best paper that really simply illustrates that was one by Mickey Bendor and Raphael Sotoli called, I believe it was called the trophic level of the human in the Pleistocene. And that was using stable isotopes to really, of samples of bones to really plot the humans on, as they related to other animals on a trophic level. And I believe there was at one period in the Paleolithic where we were found to be 70% basically hypercarnivores, where 70% of our diet was meat. Um, so I think there's scientific evidence that kind of justifies what Dr. K is seeing and I'm seeing in the clinic, which is when you put a patient on an exclusion diet, these massive range of symptoms just seem to disappear.
Absolutely. And the challenge obviously is we're always trying to answer what did we eat before? And it is overwhelmingly obvious that the majority of our nutrition was animal based. Plants are highly toxic, and finding the right one to eat that's not going to kill you wasn't so simple in our ancient past. Likely, there was a lot more large uh, um, ruminants in the world and animals roaming the world that we had, and there were far fewer humans. So we figured out how to make the tools, how to utilize hunting practices similar to wolves and lions, which I believe were really truly more like wolves and lions. And but ultimately, even if you think we were a high plant eater at one point, it's somewhat irrelevant because we're trying to figure out the cause of disease today. And ultimately there's only one experiment that's required, and that's you. And so if you're looking for the scientific, prospective, randomized, double-blind, placebo-controlled study to answer it is never going to happen
Yeah.
because the propaganda is powerful, and you've got to be your individual life learner, but you've got to do your own experiment on yourself, which is ultimately what I did.
Yeah.
I tried every drug. And as you said, we're really great at writing drugs. And sometimes it's like, well, it's just normal. You know, I had aspirin, Motrin, I had antiemetics, I had things for gastrointestinal problems. You name it, I had the drug. And when I finally went carnivore, it took me 2 years to realize that I haven't taken any of those drugs. And I'm like, wow. And so, again, don't believe me one bit. But if you're suffering and you want to do, the number one challenge is eliminate plants and focus on fatty meat. And I believe one meal a day is the very best way. And you will feel and know the difference. And people will be like, what are you doing? You look amazing. Your energy's amazing. And I can see the vibrant color and energy that you have.
That's a great point to maybe share with the listeners your exact approach, and you've got a mnemonic that kind of hits on the kind of groups that you like to recommend.
Well, I call it the baby's way, since as a fertility doctor, uh, bacon, eggs, butter, beef, and salt. Now, there's an I in the babies, again, Bebbis, and intermittently feasting and Kiltz's ice cream. Because life is not meant to be tortured. You got to reward and treat from time to time. We drive cars, we fly planes, we do plenty of dangerous things in the world. So this isn't to say, boy, you better never eat a plant, you better never drink an alcohol, it and cookie, cake, and ice cream from time to time, fruit and honey from time to time. But most of the time, for me, it's one meal a day at night. It's meat, fatty meat, salt and water. I may put a little bit of butter on it, and that is the strongest nutritional way you can do it. And but again, you're going to find your own individual way, but we are nearly identical as human beings. Our DNA is nearly identical all around the globe. And so every organ system or body pretty much works the same way. Our cells work the same way. So we have to realize that our body needs lots of oxygen, right? Not too much, though, and not too little. There's a sweet spot for that, too. And then a little bit of water. I love Gerolsteiner, but a great mineral water I think is good. And then you need fat and a little bit of protein. You do not need a lot of protein. So I try to keep it simple. I could eat steak, salt, and water every single day, just like most other animals in the world. They're eating the same diet every day. Variety is deadly, in my opinion.
Mm. And I like how you included that occasional fruit and honey, because from my point of view, I think that it is appropriate to cycle in and out of different metabolic modes, and I personally think remaining in a very low carbohydrate state with carnivore as the default is the most appropriate, but maybe seasonally when there's something like um, honey available, cycling that and really oiling up that carb or that glucose burning machinery is important in my mind. How do you can you explain what your experience has been with women, particularly doing a very low carbohydrate and maybe intermittent fasting? Because there is a belief, I think, within lifestyle medicine circles that women aren't suited for those approaches.
Well, in our ancient past, we didn't have a cupboard, refrigerator, or snack foods to carry around, and there wasn't a quick stop around the corner. We likely went days, if not weeks, without food plenty of times in our environment. Uh, most animals have times of fasting, depending on winter time or nesting time or hibernation time or migratory times. I do not believe that women and men are metabolically different. We are the same. But remember, we're still the propaganda of, oh, you gotta eat in order to maintain your energy and your metabolic machinery moving. So number one is sugar, glucose, is never the energy for the mitochondria. It's always fatty acids that break down into acetyl CoA. Sugars must go to the liver and via insulin be converted to fat. So when we talk about metabolic flexibility, I think we're wrong. There is no metabolic flexibility. You can't breathe air and breathe water. We breathe only air, and you burn only fat. And so women and men are the same in their metabolic processes. Now, it may be, and it is true, I believe, that women carry a little more fat in their bodies because of reproduction. One is you have to have enough fat to have a normal menstrual cycle. Two is when a woman is pregnant, hyperemesis is common in the first trimester. Hyperemesis is nature's way of saying, do not eat, because we have to allow this beautiful fetus to implant and grow enough in order to have a good hold on its future. Plant sugars glycate, plant hormones, estrogen, progesterone, testosterone, and the abortion pill is initially made from plants, I think are highly toxic and deadly to the egg sperm embryo and the early implanting embryo. So I think the fat allows more fasting, days to weeks of fasting. Look at penguins and look at polar bears, look at many bears, and look at many other organisms that hibernate or nest or migrate. They burn only fat. So having more fat is better. When you add the plants, remember, when we talk about sugar, glucose, we're talking about plants. Again, people think, well, sugar or fruit or honey. It all comes from a plant. Plants, I believe, are the predators and we're the prey. They utilize us quite readily. Plants make heroin, cocaine, marijuana, nicotine, caffeine. And so that's why I think that hibernation and nesting and fasting are critical. And if you're not fat in a famine or in the pestilence and diseases of the world, or in early reproduction, you will lose your reproductive potential. You'll miscarry, abort that baby. It'll cause birth defects, or you and your cell and that fetus may die.
Mm. That's an interesting story, or the interesting interpretation of the role of hyperemesis in human physiology. I've got a story. A good friend of mine, a regenerative farmer, sells really high quality meat in the town that I'm living in, and he had a customer come up to him, and she was in her first trimester, extremely bad hyperemesis, just vomiting all the time, and she said to him, "Jake, the only thing I can eat is your eye fillet raw. That's all I can eat." And that was the only food that she could keep down. So, talk a bit more about why exactly the body would be putting a woman through such a period of nausea and vomiting.
Well, so um, number one is the drive in the world today is to be skinny, isn't it?
Mm.
Every woman and even men want to be skinny and built. But that's not what any other animal wants. It wants fat. And so, but we didn't have the access to 3 to 6 meals a day, which essentially makes us over fat. And then the sugars cause the damage, cause the disease. But um, again, the protective mechanism, and there was just an article in the New York Times or the Wall Street Journal of a physician at, I think it's USC Keck Research Institute in Los Angeles, that basically suffered from severe hyperemesis. I apologize, I don't remember her name. And she's done research on this, and she even spoke of the same concept that hyperemesis is a protective mechanism to prevent eating either the wrong foods or any food in that early first trimester. Just think about it. What are we born for? We're born for reproduction. We're not born to be doctors or bloggers or any job in the world. We're born to find food, find shelter, protection, and reproduction. That is really it. All right. And so my bet is many and most animals spend plenty of time resting and digesting and resting and gestating. So there's no reason to go exercising ever to burn calories, to be skinny, to deplete your fat stores, which are the fetal foods. And so hyperemesis is in our plant-based toxic food environment. Hyperemesis is on the rise. But the problem is so many of those women are ultra skinny. So they don't have the backup in order to thrive and survive. A baby is actually grown from your fat stores. You don't require any food as long as you have plenty of fat stores. And plenty of animals gestate for whatever the number of months of their gestation, and they lose fat. They don't lose bone or muscle mass at all, and they don't eat. So I believe we have to relook at what is the normal weight. Our BMI measurements are way too low, I think. And I take care of plenty of high BMI women who have babies by simply going keto or carnivore, and they don't lose much weight. And again, the overweight patients are prepared for hyperemesis. The underweight women are not prepared. But again, it's a survival mechanism to not eat. And I keep my plastic plant nearby, not to eat the poisonous plants. They're all
Yeah.
poisonous.
Yeah.
I don't care. Lettuce, salad, carrots, asparagus, every fruit, and even honey. So I don't recommend fruit or honey of any significance or frequency, even seasonally.
Okay. I mean, what would you? I like to think about fermentation as one method of inactivating or at least highly reducing the toxicity of certain plants in things like kimchi or sauerkraut. What's your opinion on including something like that in the diet?
Well, if you look at it carefully through soaking, fermentation, cooking, and other methods of reducing and or eliminating the toxics in plants, we can consume them. So if you're choosing those foods, then fermentation or soaked will provide the sugars with less toxicity. But don't be fooled to think there's no toxicity in there, because you're still getting some toxins. And by eating a high plant-based diet and or simple sugars, you're feeding the microbes in your mouth, in your esophagus, in your GI tract, which ferment in your gut, correct?
Yeah,
And
definitely.
fermentation in your body makes alcohol, heat, methane gas, and aldehydes. So you're making fermentation products internally by supplying the gut with the sugars. And most plants come with live bacteria and yeast, which is providing the environment for fermentation in our body. So in general, look at food likely became harder to obtain. So you either you risk starvation, or you risk sickness. But the sickness was, we were able to tame that in general because we figured out how to ferment and soak, and you could take corn and uh, do things to it that makes it more accessible and less toxic. But again, it still provides sugars which glycate, and a high plant-based diet causes damage to our proteins, our mitochondria, our glycobiome. And the glycobiome of a human is different than the glycobiome of plants or bacteria or yeast or viruses. So those foreign glycans are damaging us also.
Yeah, and I really I agree, and I think that the adaptation or the use of plant-based foods as an inferior energy source in the absence of access to animal fats, and that was a beneficial adaptation that we had to go through, as you said, Dr. K, probably during a period of leanness, and probably after the extinction of megafauna, when suddenly we didn't have this smorgasbord of nutrient dense animal fat, so we had to make do with inferior sources of energy. The most common retort to a position, the carnivore position about the toxicity of plants, is that there is a hormetic or beneficial effect of ingesting amounts of phytotoxins or plant compounds that is good for health. What's your opinion and take on that position?
I guess a little bit of heroin every day is okay. So the problem is, we don't know the cause of disease in our current paradigm of discussion, right? So heroin, cocaine, marijuana, nicotine, caffeine, cyanide, how much is okay? And we're duped. And even alcohol. Oh, a glass of wine. The American Journal of OBGYN suggests a glass of wine for a pregnant or lactating woman a day. Does that make any sense?
No, it doesn't.
So I think we're simply trying to support our own addictions, all of us. Like, I'm off coffee now for 9 months. So when I used to drink coffee, oh, it's okay. Well, let's just say maybe it's less harmful. Maybe you feel good on it. It's a drug, right? Drugs make us feel good, but that doesn't mean it's good for us. And that doesn't mean it doesn't have some adverse effects in our body.
Yeah.
And my bet is again, we are, Occam's razor says the simple answer is the one, right? Well, honey's good for you and fruit's good for you. Well, it makes you feel good. That doesn't mean it's good for you, right? We're getting to a point where we want to support our own belief systems, which, because we like to eat them and drink them. I mean, I have an alcoholic drink once in a while. I might smoke a cigar with my buddies once or twice a year, right? It sits like this, right? Now, some, oh, I'd never do that. Well, I drive cars, and how many people are killed in cars every year? You know, I go to a concert, a big event, a game. Well, you know, that's risk of mass infection or, you know, mass suicide. All sorts of things can happen in this world. But
Yeah.
I would say hormesis is just wanting to support our own belief systems and things that make us feel good. Ultimately, I think there's some toxins in them, and that may be causing disease that you and I might not realize.
Yeah, no, and I definitely agree that it seems people are very eager and very able to find all manner of justifications for their habits that they enjoy doing, and addictions is definitely probably the more correct word. I want to explore the overfat and the fat that you talked about, because you said something really interesting, which was you believe that BMI targets are too low. And what we've obviously seen, particularly over the past 50 years to 60 years, is that obesity rates have gone up dramatically. And they are at the same time as a range of chronic diseases, at the same time of fertility falling. Um, can you talk to the exact distinction of being perhaps overfat versus fat? What is a beneficial type of fat, and what is the type of fat that you don't like to see as a doctor and as a fertility specialist?
Well, I don't treat anyone as fat or skinny. I don't claim that someone is overweight and that's their problem, because the cause of obesity is actually the directions that the nutritional world, the healthcare world is actually telling people to eat 3 to 6 meals a day of mostly plant-based lean meat. So we're giving everyone the actual direction to be obese. But what people don't understand is the fat they make is normal based on their diet, getting ready for a famine or fertility or disease or war or pestilence or something. The cause of obesity and the cause of disease is a plant-based 3 to 6 lean meat diets a day. And so if people realize that someone's walking down the street staggering, they're probably drunk because they drank alcohol. Well, if you're overweight, you're likely overweight because you ate food. Well, what food did you likely eat? People say junk food. I say no, you ate a high plant-based, low animal fat diet, and you're eating 3 to 6 meals a day. So if I see someone simply go on a fast or go to carnivore, in 1 to 3 to 4 weeks, they feel better. Their pain goes away. Their menstrual cycles often begin to become regular after 1 to 3 months. So they didn't lose all their weight. And we know that gastric bypass is one of the worst surgeries in the world, where people are doing stomach stapling to make a smaller stomach, but that only lasts for a short amount of time, because the drive of life is to eat food in order to get fat, in order to survive the famine. But never did we have access to 3 to 6 meals a day every single day your entire life.
Yeah.
And so if your bowels, think of the bowels between the esophagus and the rectum as a bag, a bucket. Did the majority of people ever have an empty bucket?
No, not in any way, shape, or form.
No, so the bucket is full from the day you're born to the day you die. But what's it full of? It's full of plant material, complex carbs. So that means you're secreting glucose to your bloodstream, the hepatic portal system, all the time, correct?
Correct.
So that if your glucose is elevated, insulin is elevated, correct?
Correct.
Glucose and insulin in the liver make fat, fatty liver. Are you surprised?
No, not at all.
No, we're not. Okay, and so now the fatty liver, the glycation due to the glucose, which is glycating and damaging the hepatic cells, now less hepatic cells are available for conversion of the sugars to fat. So now you're spilling more sugar into the bloodstream circulation. Now you're damaging every nook and cranny of your body. We call that diabetes. And then we call it the diabetic diseases, the liver, kidney, heart, eye, limb failure due to glycation.
Yeah.
And so, is obesity the cause of any disease? It is not. It's just a sign of the wrong directions for a human being. Because if you don't eat for 6 months and you're 300 pounds or 400 pounds, could you live healthy without eating for 6 months if you're excessively heavy?
Yeah. I
You
mean, with
can't.
sufficient electrolytes and fluid.
Water, water, and again, a bear that hibernates doesn't drink, piss, poop, eat for 6 months. What electrolytes is it getting?
None.
None.
If it's not, yeah,
Our
taking an
body
intake.
makes water when it takes, again, fat is the only fuel for the mitochondria, not sugar. and I will bet $1 billion on that one. Why would glucose have to be converted to pyruvate in order to then be converted to acetyl-CoA when you could take a long-chain fatty molecule and cut it in 2-chain particle and get acetyl-CoA at the speed of light?
Yeah.
Okay?
Yeah.
And so obesity, I have plenty of obese women having babies because they simply went keto or carnivore or fasting for a few months, and bingo, they get pregnant naturally.
Yeah.
Or it improves their egg or the guy's sperm when he does it, better embryos in a better implantation environment to make babies.
Yeah.
So again, what if the story we're telling is wrong?
Yeah.
And the story is sugar's the energy for the mitochondria first and then fat, right?
Yeah. Well, currently it is. Yeah.
What if that's wrong?
Hmm.
What if that's wrong?
Yeah. I mean, and the
Insulin's job.
mm. Oh, sorry, I was just going to say the empirical findings of putting these patients on these diets are in exactly support of what you're saying, which is that we see the resolution of disease. So, if it's like Wittgenstein's ruler, are we measuring the table with the ruler or the ruler with the table? And if the hypothesis is incorrect, then is it incongruent with empirical findings? Then the hypothesis is wrong. So, I definitely agree with that. I just wanted to make a distinction in terms of talking about obesity and specifically the visceral but versus non-visceral fat, because what Dr. K you said about developing what is essentially metabolic disease and insulin resistance is a result of eating these plant-based foods, refined foods, and high sugar diet. And when we fast or when we do a carnivore diet, the visceral fat preferentially is lost, and there's a resolution of the metabolic dysfunction. So
Right, but it's not the loss of the fat that causes it. It's the reduction in the plant antigens, the plant sugars, the plant chemicals, and the fermentation of plant in your gut. So if you remove the toxins, you remove the disease. Because many of these people will heal in 2 to 4 weeks. Their visceral fat doesn't go away. They still have it because visceral fat, I mean, I operate on people every day. They get plenty of visceral fat inside. Even some skinny people have it. Again, fat is not the cause of disease. Plant sugars are, plant chemicals are, plant antigens are, and the fermentation of the plants in the gut. Those are the 4 leading causes of disease. Because again, we still focus on obesity and fat, but it all depends on how long the famine is going to happen for. You know that, right?
yeah, keep going. Explain.
And and so uh, we're built to get fat for the famine. Polar bears will not reproduce unless they're fat enough. They'll only have one cub if they're certain size. As they grow in size, they have more polar bear babies. Okay, and so I think part of what I'm trying to do is change the paradigm of the conversation. Oh, you're obese, you're unhealthy. But that is not true. You're unhealthy not because of your obesity, because of your diet. It's like heroin every day, cocaine, marijuana, alcohol every day. Right? What does that do to people's health? And insulin resistance, by the way, I believe insulin resistance is as the liver damages, the liver function drops, the ability of the liver to convert sugars and amino acids to fat slows down. So the liver's function, primary function of the liver is to make fat, not to detox. Because you can't name a disease that the liver is not detoxifying, can you?
The liver isn't detoxifying.
So everyone says the liver's main function is to detoxify the blood, correct?
Yeah, inactivate range of dietary and other toxins. Yeah,
Well, what
one
toxins?
function.
Name a disease. What's that?
Yeah. So one function of the liver. I mean, that's in terms of what we're taught is that that's one function through the process of glucuronidation and all kinds of other processes. Sure, go
But
on.
in a two patients, in a type 1 diabetic and a liver failure patient, the liver does not make fat. And if you don't make fat, you die. Most human diets around the globe are fruit, fiber, vegetables, seeds, nuts, and lean meat. What's missing from that diet?
Animal fat.
Animal fat. Plant oils, people do not eat a lot of plant oils. They sprinkle it on and they cook with it. They're not drinking gallons of plant oils, which I think are toxic personally. But ultimately, and they're industrially produced. Animal fat, one is the fuel for your body. Two, it suppresses inflammation in the bowels. And it's most satiating. If you eat the fat, you feel better, you reduce inflammation, and you lose weight probably for a couple of reasons. One is you tend not to eat as much because you're more satiated. And two is the fat we eat is ingested through the lymphatics. So amino acids and sugars go to the hepatic portal system, go to the liver, but the fats go to the lymphatics. But they're internalized via the chylomicrons that develop in the gut via bile and pancreatic lipase. Well, there's only so much bile and pancreatic lipase that's going to be excreted in any one moment or in any day. And probably you only have so much. So if you eat 10,000 gallons of fat, but I bet it's mostly our satiation and we just stop eating because, like, I eat one meal a day in general, high fat with steak, and my appetite goes down fast.
Yeah. And look, we agree completely about the toxicity of plant oils, and there is good evidence on a biochemical point of view that the breakdown products of linoleic acid, including compounds like 4-hydroxynonenal, are directly toxic to our fat cells. They drive overeating through the endocannabinoid system. But I think that what the contribution to the impaired fertility in people who are eating these oils is through insulin resistance and is through the dysfunction of the fat cells specifically. So, I mean, going on carnivore is the umbrella solution because you're replacing and you're removing those type of oils completely from the diet, and replacing them with a more satiating energy source.
Well, the plant oils. Think of plant oils come with plant phytochemicals. Okay, so think about CBD. CBD oil comes with THC, correct?
Mm-hmm.
Right. So every time you get a plant oil, you're getting a plant phytochemical. Okay.
Yeah, range of
See, I really
phytochemicals.
think what's that?
A range of phytochemicals. You're getting phytosterols. You're getting all kinds of phytochemicals.
They're the toxins for our reproduction, technically not the fat directly. Again, I'm giving you what I believe is a slightly different take on it
Mm.
because I'm in the world of herbal medicine for years, and every herbalist wants to give an essential oil, right? Or an herbal medicine. Those come with phytochemicals, including estrogen, progesterone, and testosterone, which are basically cholesterol in their production. So they easily are dissolved in fat and distributed everywhere. So again, when we blame the fat, we're forgetting about plants and even some animals that you may eat. The animal could have consumed a plant. There's a journal called the USDA Journal of Plant Toxins and Poisoning. If you haven't seen it, you must. The livestock industry is very cognizant of plants that kill and damage and disrupt animals. But the industry doesn't care about the damage we get, because when the livestock is damaged, they lose money. But when we're damaged, someone makes
Makes
money.
money.
If that makes any sense.
Yeah. I think that's a perfect
And
segue into. Sorry, go on. Did you have the rest of the point you were going to make? I
no,
was
no,
just
no. I think that was it.
Yeah, I was going to ask you. That's a great segue because I've heard some very interesting takes on, I guess, the influence behind the current system and where we're at from a health and nutrition point of view. So talk a little bit about what you said earlier in the conversation about propaganda and I guess the narratives, and how do we get to this situation where most people are eating plant foods most of the time, and thinking that's the healthiest thing.
5% of the lions are still lions. 95% of the lions are now sheep. If a lion and a wolf is fed a plant, they become domesticated animals. That's called a dog and a cat. If humans are fed plants, they become a domesticated animal. A slave, a soldier, a peasant, and a prisoner. We will fall in line and stand in line to go to a concert, get beer, wine, whiskey, tobacco, coffee, tea, or listen to a concert. Be the lion. Eat like a lion. How did it happen? Well, look at eating plants is easier than going out and killing an animal, because I could just walk to an easy place and they got things I can eat right away. For some reason, some people are more susceptible to the antigens, the chemicals, and the sugars than other people. Why? I don't know. There's certain makeup, but ultimately, almost every single disease is caused by that plant-based diet. Making money and being powerful and controlling the universe, the kings, the queens, the pope, the priest, the president, the professors, and the physicians, all P's, by the way, have a mission of I'm right and I'm here to tell you what to do, right? Now, I'm not here to blame anyone else, because there's only one person responsible for my life, me. No matter what it is, no matter what troubles I have or anything that happens to me, I'm not here to blame anyone else, but social media is social medicine. This conversation is ways for every young man and woman, every girl and boy, every child, every young and old to learn that we are lions that have been removed from the lion's den and put in the pig's pen. And the only way to take control is listen and learn, but then do something different. And there are plenty of vegans that are healthy and well, and carnivores that are not so great. The why part of it is always the conundrum, the yin and the yang. There's always going to be the fight, because that's the nature of the universe. But lions lead and sheep be the feed for the lions. It's the same thing. All around the globe, see the power struggles of the world, and the nutritional industry and the doctor industry, the physician, all knows what's best for you. And you got to be done with that. You got to take control. And since I became a carnivore, and I've written, I keep writing something new and different, keto, then carnivore, share ideas, and how people can maybe take control of their lives and recognize they're a lion. How and why does it continue? Because people like power and money. This is the nature of the universe. And the same thing for all of us, even us, but ultimately you have to read a book, Why Beautiful People Have More Daughters. I don't remember the author, but ultimately it's only for reproduction, because reproduction is all that matters.
Yeah, that's a very very interesting take, and I agree that that the fact is that most people are habituated or inculcated into a paradigm where eating foods that don't make them feel and don't healthy and don't thrive is just the norm. And I think a lot of people are just so used to that to feeling so average. It's almost like the glasses are dirty and you can't remember about when they were last clean. And going on an elimination diet is like, in my mind, cleaning those glasses and really allowing someone to see again. So I really encourage and echo all your statements, Dr. K, about using yourself as an experiment, because at the end of the day, any kind of clinical trial, observational trial, epidemiological research is not going to be externally valid to you as an individual, and you're never going to be able to do that extremely high fidelity, high modular experiment that is your elimination and reintroduction diet. So, I really echo those calls to use yourself as an experiment.
Occam's razor says the simple answer is the one. You're looking for a scientist or a politician or someone to tell you the answer, and you're the only one that's going to find it. And you got to go out there and do something hard. And I like your analogy of cleaning your glasses. Carnivore, one meal a day, is just clarifies the mind, and you feel more vibrant and energetic. And you can say no to the food more easily when your brain is like, wow, I feel it, right? And so I call science and data snake oil and doo-doo. If you're waiting for any scientist to tell you, oh, I figured it out, you're going to wait till the end of your life. It ain't there. Because even these randomized prospective studies that prove that meat is good is all bunk. And I don't mean to be sort of disrespectful to anyone, because even on a plant-based diet, you can actually be healthy if you add the fat and eat less frequently and cook it and prepare it in a way that it minimizes the toxins. But the carnivore way is the 5% top of the line. That's the master class, in my opinion. And so it's kind of fun. This is so fun to talk about. Again, I've got my beliefs. You got your beliefs. We all hold our own beliefs, but it gives us something to talk about, because otherwise, if we all believed in the same thing, it'd be kind of boring.
It would. And it's funny how both of us, who have both gone through decades of medical school and higher university, both agree that the research underlying basically the entire nutritional recommendations is very, very poor quality and is not valid or robust enough to be basing individuals' health recommendations, let alone whole populations. So again, it's about looking at what is good for you as an individual. And it's a spiritual point. And I know, Dr. K, that you have a spiritual following and a spiritual aspect. I mean, spirituality is about changing ourselves first. And I really love how improving that our diet might be the first entry point for people to kind of develop more spiritually, because they lift that veil of brain fog and they clean their glasses, metaphorically speaking.
I think that's one of the most important things that we don't talk about in the nutritional world is faith in God. And God is within all of us, and each person has their own vision of God. But I think it's important to honor God in everyone and everything, and have faith first. I would say faith first, fertile fatty foods, to really develop the fitness and the fertility of your life. And it's not just about making babies, it's about a reproductive life. And everyone is capable of hard. Everyone. There's no you got a pulse. You can fog a mirror when you breathe. You're alive. You're capable of anything and everything. And that's the part I think we have to have fun in this keto carnivore nutritional health and wellness world. And that's one of the things that doctors are kind of negative Nellies. It's, oh, you don't look so good. Oh, your blood pressure, you're this or that. Like, how you doing? Like, you look great, amazing. Matter size or shape or whatever it is. And your blood pressure, let's work on it. Maybe I've heard of this thing called carnivore. Have you ever heard this stuff? Maybe you should try it.
Yeah. Yeah. I mean, it's empowering. And I really like that. That's a great place to kind of wrap this conversation up, is we're both about empowering you as a patient and all our listeners.
Yeah.
It's about empowering you with information and the ability to discover that level of thriving that you're entitled to and that you were born to, and that has you haven't been able to access up till now. But yeah, I really encourage everyone to follow, kind of try Dr. K's approach, see how you feel, and just don't dismiss it out of hand, or don't don't make a judgment before trying. Um, any parting thoughts, Dr. K?
Well, Max, I just want to tell you and all your listeners and watchers that I really appreciate what you're doing, and to keep doing what you're doing. And everyone is empowered to be themselves. And the more you are listening and learning and watching, creating yourself, the more enjoyment out of life you're gonna find. And hard is something everyone's capable of doing. But again, gratitude is the attitude, and I'm grateful to you. So thank you for inviting me on today. I appreciate it.
Thank you. Absolute pleasure, Dr. K. Thank you very much.
All right.